My name is Chitundu Mbao. I'm a senior pharmacist at Ndola Teaching Hospital, and I'm in charge of the production unit. We focus mostly on two things. One is the alcohol-based Handrub, also a surgical skin scrub that we produce for the theaters. Well, in 2013, through the African Partnership for Patient Safety, we were partnered with Guy's and St. Thomas. And through that, we were introduced to WHO in 2013. That did a training. So we had two of us who were trained in Zambia, two pharmacists, myself and one other pharmacist, to produce alcohol-based Handrub. So the purpose was to empower low-income countries to be able to produce Handrub in-house. So WHO calls it in-house production using their formula. Basically, our role does not end here. We hope we'll be able to reach other facilities to be able to train them so that they can start producing Handrub.
Okay.
So one of the biggest challenges is the rising price in commodities that we use, raw materials. Yes, we've been seeing a drastic rise of commodities, and basically it means that the production cost goes up. Okay, well, sustainability first starts with management. So management at our hospital has been very helpful in terms that they have allocated us a fixed budget within the finances of the hospital monthly that we are able to utilize to procure the raw materials and any other things that we need. The other thing is also acceptability. The facility and the staff within the facility have been able to accept the Handrub that we produce and have been able to use and demand for it when it's not available. So that has kept us going. We have specific equipment, and bear in mind the WHO formula that we use is a simple formula that has been given to us, which we can use to produce it using very bare minimum requirements in terms of equipment. And most of the equipment that are needed are just glasswares, packaging materials, and a little bit of paper for labeling and all that. So it's not sophisticated equipment that is needed for production, but basic equipment within the reach of these facilities. So the cost of the materials and the equipment is quite minimal. Management asked me to provide a budget of what we needed to kickstart the production. Maintenance is easy because certain equipments do not get broken down very easily. Others are much of packaging material which we just disinfect and repackage. So majority of the packaging material that we use are reusable. So we wash them and then we disinfect them and repackage once and for all. The production process does not require much of staffing. It can be done by one person mostly. One thing I can say is the patent for the formula that we use is WHO. WHO has given us a blessing to use their formula and produce for in-house, bearing in mind that there are certain requirements within each country that are supposed to be met. For example, the fire safety of where you are working from. So even in hospitals, there are certain legal requirements that each institution need to put in place. Basically, according to WHO, it's been given to us to use in-house and not really as in a commercial part, but they have allowed hospitals to remanufacture using their formula and basically help patients and staff in infection prevention within the hospitals where it's being produced.
Okay. Thank you very much.
Thank you.